All right, everybody, let's go ahead and get started. Like I said, today we have Miss Meredith Bazemore from UNC. So thank you for coming, and you should be able to share your screen.
Fantastic. Hi, all. I'm going to actually turn my video off after I say hello. Just wanted to introduce myself. Thanks for having me today. When I share my screen, I'm not sure if I'll be able to see the chat, but if there are questions that come up, if somebody will just interrupt, ask away, and then at the end we can circle back and do a little bit of Q&A. My slide deck should definitely not take an hour, but if there are questions that come up along the way, don't hesitate to jump in and ask as we go. All right. All right, can you guys see screen?
Yep.
All right, perfect. Well, as I said, my name is Meredith Bazemore. I'm the director for the Office of Rural Initiatives at UNC. In addition to myself, Dr. Caroline Roberts is our faculty physician champion. She is a family medicine doctor who practices in both Caswell and Chatham counties, if you're familiar at all with those counties. And then Kiwana Smith is our program coordinator. And if you all and as you all get ready for applications, and if you have questions about our programs after today, Kiwana will be a great contact as well. She works with all of our programs and is a good source of information. So feel free to use these emails at any time. I will put these in the chat at the end of the presentation as well. We are always happy to hear from students and always excited to develop relationships with students who might be interested. So our office was really designed and established in 2017 to think about how we address the healthcare disparities of rural North Carolina through the recruitment and retainment of a diverse primary care provider workforce. So we recognize our rural and underserved communities across the state have unique needs. They also have incredible assets. And so our office really thinks about how do we connect the pipeline of programs through education, recruitment, exposure, and advocacy to best support communities across the state. I wish I had a poll. I have another slide deck that has a poll question in it, but this isn't it. Can you guys, let me see, I think I can see the chat. Put in the chat where you're from. How many of you are from North Carolina? And if you're from North Carolina, what county you're from? I'd just love to get a sense of who you all are. Hoke Union. All right, wait. Stokes. Wow, that went fast. You guys are quick typers. So I see a number of rural counties in here, which is fantastic. I've spent time in most of them. One of my favorite stories is from Harnett County down in Lillington. So I'll share that if we have time at the end of the day. Chatham County, Rhea, I live in Chatham County, so go Chatham County. Cool. So it's awesome. You guys are from all over the state. That's really exciting to see. So as most of you might know, if you're from North Carolina, we're a very rural state. Any map you see is somewhere between 70 and 80 of our counties are identified as rural. And the reason for that shift is it depends a little bit on how they're defining the context of rural. For our office, we use the 80-20 split. So you can see that is all across the state, right? There's not just one region that is rural. It is literally our entire state. And what we know about those counties and rural counties in general, and this is not unique to North Carolina, is that rural hospitals are closing all over the nation. You can read articles about that all over the place and the impact that has into healthcare as these hospitals close. And then we'll talk a little bit more about this idea of social determinants of health. All right, so now that I've touched my chat, my screen won't work again. The Office of Rural Health designates counties as health professional shortage areas. And again, you can see that the bulk of our rural counties are identified as rural health professional shortage areas. So those in the dark orange, which is the predominant color you can see on this map, identify as having a primary care, dental, mental, behavioral health shortage. So that means all types of providers are needed in these spaces. We'll talk a little bit more about that too. This is a great quote. It's old, but it still rings true. General surgeons are the essential ingredient that keeps full service medical care within reach. And I think right now there are 30 counties in North Carolina without a general surgeon. So without a general surgeon as backup, family medicine doctors can't deliver babies. You might be hearing a lot about labor and delivery units closing and how The impact of maternal and fetal health and deliveries is in rural spaces without general surgeons. Trauma cases and internists won't do complicated procedures such as colonoscopy. So again, sort of this idea of impact and having the right providers in the right space is really important, and is what our office is thinking about as we design programs and opportunities. So health outcome ranks. I'm going to ask you guys again to throw in the chat, what are some outcomes? Like when I say healthcare outcomes, what does that mean to you? Anybody? Oh, hold on. Let me scroll my chat down so I can see. Mortality. Yep. Result of having a shortage. Yeah. Mortality is the big one, right? Life expectancy. What are some other poor prognosis? Yep. What are some things we hear about? And you all may have some ideas on this. Chronic conditions that exist in rural and underserved communities. Yep. Sickness or illness. Obesity. Absolutely. Heart disease. Yep. Hypertension, diabetes. All the things, right? And all of those things contribute to a lower life expectancy. So what this map is showing us is those same counties that identify as rural, or we identify as rural, are often at the bottom quartiles of the health outcome ranks, right? So Wake County, which is kind of in the middle of the state, I believe somebody said they were from Hope County. So Robeson County, which borders Hope down here in the southeastern part of the state, Wake County is number 1, Robeson County is 100. The distance between the two is about 90 miles. So how we take care of patients outside of our suburban and urban spaces is really important. We recognize that chronic conditions like hypertension, diabetes, obesity, food access, all those things contribute to these health outcome ranks. Have you guys heard the term social determinants of health? You can take yourselves off mute and say yes or no if you want to. Social determinants of health have become a really big topic because we can put a doctor in a space. That doctor can prescribe medication. That doctor cannot solve necessarily all the things that are impacting community health and personal health. So access and quality of healthcare is the piece that we're working on. How do we get the right providers back? But we also need to be thinking about food access. We need to be thinking about food insecurity. There's a term, food swamps, right? So if you're in a community where the only options are fast food, you might have access to food, but those food choices you're able to make are not the most healthy choices. So if I'm a doctor working with a patient for diabetes and I say, I need you to eat all these healthy foods, and there's not a space in which you can get those easily, so you don't have transportation to get to a food store that sells appropriate food choices, that's going to be hard. If I tell you to exercise and your community doesn't have a safe park for you to walk and exercise in, that's going to be a harder thing for you to accomplish. So these are all the social determinants of health that contribute. And that leads to these health factor ranks. So again, if you think back to that first map, that was the outcomes, these are the factors, and the factors are those things that contribute to the outcome. So as you all identified, right, we can, so John Patrick, where are you from again? I don't know if you go by both names, but I feel like you might.
Yeah, I do go by both. I'm from Yadkin County, and there really is no healthy food options around here.
Yeah, I was in Yadkin County for a visit to a high school, and I remember I ate at some little restaurant on the side of the interstate, like you got off, and it was kind of like a trailer style building, and it was fantastic vegetables. However, those vegetables were all fried, all very buttered, and it came with a biscuit. So while I was eating some vegetables, it probably wasn't the healthiest choice, but it was really good. So yeah, I mean, just things like that, Hope County and having to drive to Fayetteville, all those things contribute to these health factors. So when we think about health factors, education, access to food, access to healthcare, poverty, if we think about the economic stability of many of these communities, what happens in the southeastern part of our state every year? Robeson County folks should know this, Hope County probably. Hurricanes, right? And who's impacted by the hurricanes most readily? Hurricane season, right, Tiffany? Yeah, and it is these same communities who are already faced with hurdles and obstacles in their healthcare continue to be hit by natural disasters. And so how those things all come together to impact health outcomes is really part of the story that we're trying to tell, and have people understand why it's important that we think about population health. And medicine is one piece of that, but there's also context of how physicians can be leaders in helping drive policy to better improve their own communities. And again, those communities are incredibly resilient. If you have ever been to been to an area that's been hit by a hurricane, the way in which people come together and support one another is very different than in an urban space. It is a connection of community that is really of value that you don't find everywhere. So we talk about all of these challenges in rural, and then oftentimes what people don't hear is all the beauty and the resilience and the sense of community that comes. Those of you that are from a rural area, what's your favorite part about, and those of you from an urban area, what are your favorite parts about the community in which you grew up or you live now? You guys can take yourselves off mute and say something if you want. Loved how close knit everyone was. Yep.
I could definitely say that even people who don't know you will usually help. Like sometimes, one time my car broke down and just random strangers will stop and ask if you're okay and ask if they can do anything for you.
Yeah. Rural has fresh air. So Facebook for neighborhood, that's awesome. So we asked this question to boards of hospitals. So all the people who wear the suits every day, which is way above my pay grade, the C-suite people. And we said, what is it that you love about your rural community or your hospital? And we got lots of feedback, right? And lots of things. And somebody said that I can walk outside and see the stars. And I think the beauty of that statement, right? That there's space to spread out. It is this idea of tight-knit community. I lived up in Watauga County. My husband was still living in Chapel Hill, and I was up there and living by myself, and we had a terrible snow. And the neighbors that I had met one time in the time I had been living there came and shoveled my driveway. We had a flood. They came and checked on me. And these weren't people that I would have considered friends, but they knew that I was living alone and knew that I might need some help in that time. And those are things that we just find as sort of unique attributes. And when you're a provider in a rural area, the value you bring to that community, people love you, they respect you. You see them everywhere. But it's really just the gratitude that is shown to providers who come and work in those rural spaces is something I don't know that we talk about enough. So let's talk about some of the programs that we have that might be of interest to you all. Our Keenan Primary Care Scholars Program is probably the most well-known. It might be the one you've heard about if you've done some looking into rural or urban. We do have an urban track too, primary care. The first program, which is an accelerated curriculum program, we have a first generation initiative. I'm not sure if anybody identifies as a first generation college student or will be a first generation medical student, but we have a partnership with the Office of Scholastic Enrichment and Equity that works with our SMNA and LMSA groups and LGBTQA groups. And we came together and said it's really important that we support first generation students who are in medical school. There are some unique challenges to being a first generation student in medical school and how people understand the context of the work you're doing. We have a Promise Scholarship, and then we host pipeline program events, which is some of the work that we're doing here tonight. So this is just a visual of some of the examples of our programs. So the Rural Medicine Project is a partnership at UNC, MED and SEP. What year is everybody? Sophomores, juniors, seniors? Senior, junior, senior, woohoo, all the seniors. Sophomore, all right. First year, oh, Maggie's at the beginning. All right, so a couple programs I'll share with, just since there's a different, there's a mix of folks. SEP and MED are 2 summer programs. SEP is typically for sophomores, and I've got a more detailed slide. MED is normally like juniors, seniors, or as a post-bac opportunity. MedServe, those of you that are seniors, if you're interested in taking gap time, the MedServe Scribe program is a really great way to show direct patient care. It is a great way to show service. You work as a scribe in an under-resourced community clinic across the state. The middle line is sort of all the things we do in medical school, and then the bottom line is what we do for students after they graduate. So we really help students find support and connections as they look for placement across the state professionally. Oh, I'm back to not being able to use my. So this is a little bit more about the science enrichment program. If you guys have specific questions about this, I would encourage you to reach out to this address at the bottom. It's sepprogram@unc.edu. It is a 6-hour, or 6-hour, not 6 hours. It's a lot more than that. It's for rising sophomores and juniors. You spend 6 weeks on campus at UNC. You receive a stipend. You do all the things that are listed here. So there's lots of classroom. There's also connection to faculty. There's lots of skill sets in terms of like test taking strategies, essay writing, shadowing a working professional. If you're interested in learning more about this program, I'm happy to connect you directly to their leadership team, or you can email this email address below. But it's a fantastic program if you fall into one of those categories and may be of interest. The second one is the MED program, which is sort of the second layer of SEP. So this is for rising seniors. Sometimes, yeah, so rising seniors and post-bac. So you have to have a specific set of prerequisites already completed before you come to this, because it's a pretty intensive academic program. Lots of people say it's basically like the first semester of med school, and that you're drinking from a fire hose the whole 9 weeks you're there. It is much like SEP in that you come and live on the campus. There's lots of classroom activities, there's hands-on activities, there's professional development, test taking, work with Kaplan for MCAT preparation. And it is hosted out of our OC. We call this office the OC office, OSEE. So if you're interested in learning more about that program, those two contacts are fantastic. Also, you can email me and I'm happy to connect you directly to either one of them. And it's for medical and dental, much like SEP. And then I'll share a little bit about these primary care programs. All of these, though, you have to be admitted to UNC before you can apply. But our primary care scholars program, our Keenan program, you can be a Keenan program on any of our 3 campuses. So that's a pretty cool opportunity, because say you're from the southeastern part of the state, or Stokes County. We'll say you're from Stokes County and you're like, I really want to go back to Stokes County for the summer. You could choose to be a scholar. Our central campus sort of oversees that part. But if you're from the western part of the state and you're like, I really want to go back to the western part of the state, then we would hope you could be a Keenan scholar on our Asheville campus and spend your summer and your application phase, your 3rd year experience on our Asheville campus. Same thing for Wilmington. Specialties for Keenan, if you're interested in any of these, you don't have to commit up front. You sort of say, I know I want to do primary care. As long as you pick one of these along the 4 years, you're in good shape. We're not going to hold you. If you come in saying you want to do family medicine and decide halfway through you want to do OB, totally cool with us, as long as you're picking one of those fields. The Keenan program is a 6-week externship. So again, you would go out to one of those campuses, depending on which campus you were most interested in or which space of the state. It's great because you get some clinical experience before your classmates, because you get to go be in a clinic between 1st and 2nd year, and most clinical rotations don't start till 3rd year. You get didactics, you work on a community-based scholarly project, and it's a cohort-based experience. So we have cohorts on all 3 campuses, and so each campus has their own sort of cohort identity, but then the cohort as a whole across the state has its own identity too. There is scholarship support, both during medical school and then as you match into primary care, and then as you sign a contract back in rural North Carolina for practice. So these are longstanding relationships. We meet students as first-year medical students. We are connected to those students until they're signing contracts back in North Carolina. So we know students and know these relationships. We've seen kids or seen medical students have babies, watch them get married. So it really is about the relationship over a number of years. This is just an example of the last 2 summers of some of the places we've sent students. We try to be really thoughtful about where students want to be and work really hard to find a preceptor that can take you in a space that you're most interested in. It's in our interest and your interest to find a space that you're going to thrive and that you want to learn more about. And again, you would apply for this as you come into medical school. People always ask us, well, how's it going? How's this program working? And we have 73 scholars. As of, these numbers need to be updated. Right now we have 43 graduates. 35 of those graduates as of 2021 have matched into primary care. 23 of the 35 matched into North Carolina residencies as primary care. And then of everybody who's completed residency and come back to or is ready for practice, the 5 who have signed contracts in North Carolina are all practicing in a rural county. So it's pretty cool to sort of see the outcomes of these long standing relationships. And then first, I'll tell you a little bit about it. This is our accelerated medical school program. It started with a specific focus on rural. They have expanded outside of family medicine. And so now you can do family medicine, surgery, OB, and I believe peds is on the list. You are admitted as a first-year medical student into first. You're committing to a 3-year medical school experience, guaranteed a residency in North Carolina, and a commitment of 3 years of service. So it's a 3+3+3 program. The beauty of this program is if you absolutely know you want to do family medicine and you know you want to work in North Carolina, this saves you doing any residency interviews. It saves all the travel going to residency. It saves you a year of tuition for medical school. You get your clinical experiences starting over the summer of that first year. And it really does guarantee you a commitment of 3 years of practice in North Carolina through that guaranteed residency and placement already. Let's see. So benefits, I just talked a little bit about this. You get to choose your application phase, much like Keenan. There are opportunities all over the state. So you can go wherever, you can choose which application or which program you're applying to, whether you want to be in Central, Asheville, or in Greensboro. My understanding too is they're expanding to Wilmington. I think that's probably a year away. And then partnerships with the Office of Rural Health for service. Here's just an example of cost of education. It saves you a full year of medical school education. So if you know what you want to do and it's in one of the fields that they support, it's a great program and a great fit for students who are willing to do the accelerated curriculum. All right, so let's talk about admissions because that's everybody's question, right? For how do you get into medical school? I will say academics are obviously a huge part of your portfolio, right? They want to see that you have the aptitude to do well. It is not the only thing that is important. UNC is really committed to students who demonstrate a commitment to service and commitment to others. You have to have patient-facing experience. My advice would be, I was just talking to a student and he had combined two experiences. So what it looked like is he didn't have enough patient care experience. So when you fill out an application, be very specific to what you did, how long it was, and whether or not it was patient-facing. And don't combine experiences, and be very clear about what that experience entailed. So if it involved patient experience and patient direct contact, be very explicit about that. We want to see students that are well-rounded. We want to see that you did things sort of outside of your academics. Life and work experiences, obviously, bringing different perspectives to the conversation is really important. It's important for us to learn how we care for others. Letters of recommendation and communication skills and diversity. And diversity means all sorts of things. It means people from different backgrounds, again, so we can inform one another about how to better care for patients across our state and beyond. And all of this is on our website. I'm not going to read all these words to you because it's a lot of words. But essentially, we're looking for students, again, that are well-rounded. We want you to have taken the hard classes, but we also want you to have engaged experience outside of the classroom. Volunteer experiences and abroad experiences are fantastic. We are looking for longitudinal engagement. So if you just did a 1-week thing and there was nothing else beyond that, think about how you extend that opportunity beyond that 1-week experience. So if your personal statement is, well, I went to this country and was really passionate about the care after seeing this population. That's great. What did you do with that when you came back? So if you went to a developing country and it was, you learned a lot and felt that spoke to your heart and that's really driving your career in medicine, be able to think about what you do with that information. The other thing that I would advise is that if you put something on your application, be prepared to speak genuinely and authentically to what you've written about. So if you put something in your personal statement, I'll give you an example. A student put that they really wanted to do rural care in North Carolina, and their interviewer said, "That's great. Tell me what kind of community in rural North Carolina?" And the student couldn't tell the interviewer anything about a rural county in North Carolina. They didn't know the name of a rural county. They weren't from a rural. So if you're going to put something on the paper, be prepared to speak to it and be prepared to answer with genuine authenticity about what that is. The other thing is why medicine, right? If somebody says, "Why do you want to do medicine?" and your answer is to help people, their next question is going to be, right, but you can help people by being a teacher. You could be a social worker. You could be a farmer. You could be anything and help. What is it about medicine specifically that speaks to you and why you're going through this? Why are you going to put yourself through this? What is it about medicine? Okay, I see John Patrick had a question. Not being able to do, yeah, goodness, the pandemic, right? 2020 and 2021 so far, right? Like things just aren't open. The admissions office certainly is recognizing and will take into consideration the impact of the pandemic on the ability to do things outside of your classroom. It is not lost on us. We had a year where we couldn't put students out in clinicals, even as medical students, right? So I would talk about the impact of COVID on the things that you couldn't do. The other thing is I would try to get creative as you think about your application. I just saw an email, for instance, like being a virtual teacher, right? So are there things that you could do that demonstrate community service, even if they can't be in person? And what would those look like? Or could you volunteer to do telehealth appointments or do follow-up calls with a vaccine clinic? So think creatively about other ways that you can get engaged. I think virtual shadowing in general is probably not the preferred thing. I think, again, given the pandemic, options are really limited. I mean, we're having trouble right now finding rural preceptors because lots of spaces aren't willing to host extra people in their clinics right now, right? There's still social distancing. There's still limits on people being in rooms. And so while it's not preferred in a typical year, I think as things open back up, again, be ready to jump on opportunities that present themselves. But the admissions office is taking into consideration that virtual shadowing may be the only opportunity for many students applying in next year's cycle, particularly. If you have specific questions too, I've got some general information from the admissions office. I'll get to that slide in one sec. These are kind of the big buckets of competencies: interpersonal, interpersonal thinking, reasoning, and science. So these are sort of the big core competencies that will be part of the application and how you're reviewed in terms of the application and the interview. Slide deck stopped again. Building your application, I talked a little bit about this already, so I'm not going to review it all. Personal statement, have other people read it. Have other people read it and say, does this tell you who I am? Have people who know you well, but then have somebody who doesn't know you well as well. And then how will you contribute? Those are kind of the big things they're looking for. Letters of recommendation. Professors are great, and you do need some academic references. But also anybody you shadowed, a supervisor, somebody you worked with in your volunteer service activities, those would be great. Provide guidance to them for their letter. So share the competencies from the AAMC and ask if they can include those, how you represent success in those competency areas. Doing fewer things for longer time periods. Again, doing week-long things are fine if they're accompanied by things that feel more longitudinal and committed. Do things that push you outside of your comfort zone. I think that I don't know what that might look like exactly. And then explain exactly what you did. Like I say, I just had a student who had combined two things, and what was not clear to the reviewer on the admissions committee is that it was patient facing. So be very clear and very explicit about what your experiences are. The question about virtual shadowing, I would encourage you to contact Randy Reed. Miss Reed is the director of admissions. You can ask her specifically about that. You can also send an email to the general admissions questions. My understanding is that everybody is having to be more intentional about how we look at shadowing, because we're not going to have shadowing opportunities in person this year for lots of reasons. So that will certainly be something that will continue into next year's application cycle. But you're welcome to follow up with Ms. Reed and just confirm how exactly they're doing that. And then let's see. All right, that is it for my slide. Oh yeah, we need you. So my colleague put this together, which I think is just a fun slide. All right, I'm going to stop this and turn on my video again and see if there are other questions I can answer.
Earlier in the chat, Leah asked whether it's too late to apply for the first generation initiative.
No, so the first gen program is open. Leah, remind me where you are in your academics? Junior. So it is for students who are in medical school. So it is for students who are at UNC School of Medicine. But if you are first gen and know you're interested in coming to UNC, the other thing I would tell you to do is let me know, because what I'd love to do is pair you up with a student who's in our first gen program so you can ask questions. So you can get a sense of what the support feels like at our institution. So that's the other thing, is if you guys have specific questions about any of these programs, I can connect you with a student in any of them, and you can ask specific questions from a student perspective. MED, I think MED has already closed for this year. It is virtual this year, but they're hoping by next summer to be back in person. But they have closed applications. I think those applications opened in January-ish. But I'm happy to connect you directly to Claudius and Lisa too, if you want to email me. Any other questions? Did anything about the rural counties or rural outcomes or anything surprise anybody? Were you guys expecting that's what it would look like?
I was a little bit surprised to see like where some of the not food deserts were. Like there are some places that I didn't realize had like adequate like I guess access to health. But yeah, like there was a lot. I like going across the state, I feel like outside of like very few cities, there aren't as many like the variety is definitely lacking in lifestyle, like even if it is like a good lifestyle.
Yeah, I do a lot of work in Nash and Edgecombe, so down in the eastern part of the state, and I tend not to eat a lot of meat. And I think every restaurant on the last stretch on my way there is a barbecue restaurant or a fast food restaurant. So options for choices are just really limited once you sort of get out of these areas of suburban and urban sprawl, where there's a restaurant of some variety literally every 15 steps, right? If you're I say that about doctors too. I'm like, if you're in Raleigh or Durham or Chapel Hill, you can throw a rock and hit a doctor. I don't advise it, but you could. It's just a very different space. The MED program is available for non-traditional students. So we have a number of students. In fact, I think the average age right now for coming into medical school is like 28. We have a student in our Keenan urban program who I think is 32-ish. We have students who are coming in after they've had another career and have decided, I gave that a shot, decided that's not really where my heart was. So yeah, any student who still meets that post-bac experience, that post-bac or rising senior qualification and has the prereqs is welcome to apply for the MED program. Oh yeah, the NC, the Rural Club. Yeah, we presented. I think
Club, I think.
Yeah, I think Kiwana presented to that group, if I'm not mistaken.
Yeah.
Yeah. Yeah, we were really excited when NC State started a rural health club. I worked with Brandon and Wyatt on that as they sort of were brainstorming how to get it started. So it's really cool to see that that's continued and that your pre-med club continues to do well. Yeah, I'm going to drop my email in the chat. And then what I can do is if you tell me which programs you're most interested in, I can connect you to the right people. That person might be me. I might connect you back to Kiwana, who really works with a lot of our pipelining programs. But if you're interested in like MED or SCP or learning more about FIRST, let me know, and I'm happy to connect you to the right contacts.
I have one last question.
Sure.
I remember you said like earlier in the presentation that a lot of these counties are lacking a general surgeon. I guess in the sense of like when these surgeons aren't either willing or able to go over to these areas, I guess like what do you guys do? What do you do in those cases? How do you give these people care? Because transporting them is also pretty pricey, I'm assuming.
Pricey and dangerous, right? If you're in an acute situation that needs surgery, most of them are transported, whether that's airlifting, depending on where you are and how far away you are from a critical access hospital, depending on what your community hospital can offer. But yeah, that is, if you look at some of the fetal and maternal outcomes in these rural communities, it is incredibly discouraging. And a lot of that has to do with they don't have the ability to do like C-sections in many of these places. So if there's a crisis, they're having to be transported out of their community. And those are often long drives. So yeah, same thing to if somebody needed an emergency surgery and don't have opportunities or even general surgery, they either have to wait, they have to go way outside of their community to get care, which is one, more expensive because then how do you pay for housing for your family to be there? It's more expensive in terms of travel, it's more expensive in terms of specialist referral, like all the things. And that's why we are really interested in working with students who might see themselves working in rural North Carolina to find opportunities to support them to make that happen. It's the reason the FIRST program buys back basically your medical school. It's the reason we offer scholarship support. It's the reason we work with the Office of Rural Health that has opportunities to pay down your loans. So if you sign a contract in one of these rural places, not only have we reduced your debt through Keenan, those contracts allow you to have your debt paid off for every year of service. So there's lots of opportunities because there's a vested interest in doing better work to support healthcare in our rural spaces.
Okay, thank you.
Yeah, of course.
All right, guys, do we have any more questions? All right, in that case, I think we're gonna go ahead and wrap it up. Ms. Bazemore, thank you so much.
Fantastic.
What's
Yeah,
that?
thank you. And yeah, I was going to say thank you. And if you have, we were trying to do a better job of seeing how many students we're reaching through our work. If you can send me, you don't have to send me names or unless people are comfortable, but sort of the count number of students who attended tonight's session, so I can add that to our opportunities. We get asked all the time, well, how many students do you talk to in a year? We're like, oh. So we're trying to do a better job of being more mindful about collecting that information as we do these events.
Okay, so do you want like how many people attended or like?
I mean, I'm happy to have names and email addresses if people are comfortable sharing. If they're not, just a general number is also fine. Whatever, I'll let you all discuss that after I leave. But yeah, that would be helpful either way it lands.
Yeah, definitely.
But I'm happy to connect to students. If you send me everybody's email address, I'm happy to send a follow-up email and say, here's who I am, here's my contact information, if that's helpful.
Yeah, okay. I'll definitely keep that in mind.
Great. Thanks so much. You guys have a great night.
Thank you so much for coming. You too.
All right. Take care. Bye-bye.
Bye. All right. Since she said that, I think it's pretty important for y'all to fill out the attendance. I'm probably gonna just pretty much forward that spreadsheet to her. Let's see. All right. So there's the QR code, and while you guys are doing that, this is our last meeting of the year. So thank you everybody for coming, and thanks for coming to our meetings for this year. I know this year hasn't really gone the way any of us wanted or expected, but I'm glad you guys have still stayed engaged, and hopefully this club still benefited y'all. Before going, I just wanted to say that we are trying to like set up maybe like a table or something at Tally. So feel free to drop. I'm gonna send out an email for that, and we'll probably have like little laptop stickers or something. It's a little something to show that we still are a club and we were able to do a lot this year. And one more thing. Oh yes. And for the election results, I think I'll say them now, and then I'll send out an email for it later this week. So for our co-presidents for next year, Pavitra and Jessica, two of our board members, were elected for co-president. And for secretary, Ashna Patel won that position. For treasurer, Ashley Goetz, I don't know how to pronounce that, but congratulations to y'all. And our service coordinator next year will be Maggie Ross, and our social media coordinator, Alyssa Hall. So congratulations to everybody that won, and for those who weren't able to, I hope you guys still stay engaged in the pre-med club next year. Was everybody able to fill out the attendance? And do you guys have any questions for me? All right, in that case, I think I'll wrap it up. Thanks everybody for coming. I'll send out an email about the table and the election results. Bye, everybody.